Insulin resistance and diabetes is driving an epidemic of health issues. We're going to go into the vicious cycle of how diabetes and insulin resistance will impact inflammation, gut, and glycated end products. So let's get right into this video. Diabetes and insulin resistance is a global pandemic. 26% of North Americans, 13% of Europeans, and 20% of Asian countries have prediabetes or diabetes currently. These numbers are rapidly increasing year over year, okay? So when you go to the doctor, they say, hey, your blood sugar is rising a little bit. What can we do about it? The obvious answer for them is going to be eat less and exercise, right? So the obvious treatment is eat less, exercise. If you can't get it managed on your own, you're gonna end up on a medication. So these medications have side effects, obviously, but there has been an epidemic and explosion of utilizing things like Ozempic. Obviously, the classical medications like metformin are still available. But essentially, eat less, exercise, take a medication is the answer, okay? So let's just define what insulin resistance or prediabetes is. Basically, you have a fasting blood glucose. So you fasted 8 to 10 or 12 hours overnight, and your blood sugar in the morning is still 100 to 126 milligrams per deciliter. That is a classic sign of insulin resistance. And then your hemoglobin A1C, which is your 2 to 3 month average of blood sugar, will range from 5.7 to 6.4. Anything above 6.4, they're going to say you have diabetes. So in this range is insulin resistance. Now, these are just basic markers, and I'll go into more advanced markers in another video. But if you have these markers or very close to it, you may be developing insulin resistance or prediabetes, and eventually, maybe 5 years, 10 years, you will develop diabetes. So let's get into what we call the vicious cycle and try to understand what hyperglycemia is. So we like to categorize this as a vicious cycle of insulin resistance, and you can replace insulin resistance with diabetes. So when we have hyperglycemia, basically it's an excess intake of sugar. So the standard American diet typically will encompass, let's say, milk with Cheerios, a toast, right? And your blood sugar is rising. And then you'll go to Starbucks and then you'll order a large coffee, but you get 3 pumps of caramel, 3 pumps of sugar, and extra cream. You hear this all the time when you go to the Starbucks and you listen and people are ordering their drinks. They have excess of sugar in these drinks. So you start your morning with excess of sugar. And then you'll have lunch, a sandwich, dinner might be something like pizza or pasta, whatever. Essentially, that's all sugar. So you have an epidemic of increased intake of sugar or hyperglycemia. When this sugar goes into our system, what our body needs to do is take it into the cell. And that's where the pancreas, an organ that produces insulin, comes into play. So you have hypoglycemia, or a lot of sugar in your system, and your body has to pump out insulin. So insulin is pumped out. However, because so much insulin is in the circulation, the cells for insulin receptors become downregulated, or what we call insulin resistant. So you develop this insulin resistance. So high blood sugar will cause insulin resistance, and insulin resistance, because it's not efficiently taking sugar into the cell, will cause hyperglycemia. So it's this back and forth talk where you're creating a loop and a problem, a vicious cycle. When you have excess of sugar in our system, not being pulled into the cells, you'll end up what we call glycated end products. Glycated end products are basically proteins and fats that attach to sugar, right? If you look at a steak and you burn it or grill it on the grill, and you get a lot of charring, basically that charring is really a glycated end product. So Sugar attached to proteins and fats are glycated end products. Glycated end products will also create increased insulin resistance. Another thing it will create is leaky gut. So this will start to damage the gut lining. Now there's some controversy of, is leaky gut a real medical term? Well, you can call this intestinal permeability or dysbiosis, but essentially impacts the gut lining. When you start to impact the gut lining, you're going to end up with what we call endotoxins. Things that should not cross into the bloodstream will start to cross from the gut. Larger proteins, or what we call lipopolysaccharides, can also cross into the bloodstream, and other bacteria, okay? So you have endotoxemia, starts to cause problems in the bloodstream. And it starts to activate TLR, or toll-like receptor. These are proteins that basically will trigger an innate response and an activated response, an immune response. So when you get an immune response because of endotoxemia, you're going to have inflammation. Inflammation is also going to create more glycated end products. So there actually should be an arrow here. So it creates more glycated end products. And inflammation is going to be problematic, okay? In addition, when you have insulin resistance, you're going to have hyperinsulinemia, like we spoke about. So you have increased production of insulin, okay, because of insulin resistance. It's not taking the sugar in, so your pancreas keeps pumping out more insulin. And this hyperinsulinemia will cause more insulin resistance. Another thing it will cause is adipocyte activation of fat cells. In return, that will also cause more inflammation. So this vicious cycle that keeps going round and round. Also, glycated end products will cause problems here where the receptor for advanced glycated end product reactions will occur, and that will cause hyperinsulinemia. So I know it's a complicated diagram, but I'll step away, okay? So you can have an idea what it looks like. Basically, when you have high blood sugar, it causes inflammation, leaky gut, glycated end products, more cardiovascular issues, because glycated end products is associated with cardiovascular disease, stroke, high blood pressure, and all these other things. So this vicious cycle creates a lot of health issues, and then you'll end up with multiple medications. Also, high blood sugar tends to increase cholesterol, so you end up with another cholesterol medication. So if you think about just this loop, you'll end up with a diabetes medication, a high blood pressure medication, a cholesterol medication, right? So you'll end up with multiple medications which will have side effects and long-term impact. So the question is, how do we stop this vicious cycle? How do we stop it in its track? At the end of the day, your basic answer is stop eating sugar, okay? Avoid pastas, breads, added sugars, and maybe go into what we call a ketogenic diet, where it's more fats, proteins, and very, very minimal sugar. So it would be like a breakdown of, let's say, 70% fats for calories, 25% protein, and maybe 5% of natural sugar. And you can utilize that to break that vicious cycle. You can also utilize things like an AIP diet or autoimmune paleo diet. That could be another good step. Another good way really is to do intermittent fasting. So you eat in a short period of time and you have, let's say, 2 meals within a 6-hour window. Then you're not having insulin spikes throughout the day, you're just having it within that 6-hour window, okay? So intermittent fasting can also be quite beneficial. Another one is really the prolonged fast, OMED, or 1 meal a day, or 1-day fast, 2-day fast, 3-day fast. I get a lot of patients who will do, let's say, a 3-day fast or a 4-day fast, and they tell us that their fasting sugar will be much lower. So let's say their fasting sugar was 110 every morning, right? They do a 3-day fast or a 5-day fast, and there's a resetting portion of the insulin, and their blood sugar will be 95, 90 after they do a 3 to 5-day fast, eating the same type of meals. So those are ways to kind of break this vicious cycle and start repairing how your body will work in terms of processing sugar. So those are the different steps that you can utilize. Signs and symptoms you may be developing pre-diabetes or insulin resistance. What are some of the dietary factors, chief complaints, and more importantly, those subtle signs that you may be developing diabetes? So let's get right into this video. Obviously, there's diet and lifestyle. So when you go to the doctor and you have pre-diabetes or diabetes, they basically tell you to exercise more and eat less. Obviously, those are factors. But there are many other factors. Highly processed foods has a lot of sugar in them. Social and pleasure eating. You're out and about, you have a sports event, you eat hot dogs and you have cookies and soda, beer, wine, etc. There's social pressures to eat more. Lack of fiber. You need fiber to help buffer the spike of glucose. So increasing fiber intake before having higher sugar load can help buffer that insulin spike or glucose spike. Stress is a really big factor. Stress increases cortisol, and cortisol will start to impact sugar, and sugar will impact insulin. So stress factors can increase overall sugar levels. So you may develop prolonged stress issues and cause spikes of insulin as well as cortisol. Poor sleep. There have been many studies where you don't have proper sleep, then you're going to have an increased level of glucose dysregulation. So proper sleep is a very important lifestyle factor. Now, let's look at some of the chief complaints here. Most patients will come in and they don't know they have prediabetes yet. And they'll say, I have fatigue, inability to lose weight, I have joint pain or muscle pain, depression, mood issues. You have thinning of the hair. People don't realize when you have prediabetes or diabetes, you may start to lose some of the hair, especially, let's say, in the distal extremities, like your leg, around the ankle, mid-calf. You can start having thinning of the hair. Why? Because glucose and insulin will start to impact blood flow. So the microvasculature at distal ends, like your fingertips, your toes, or your head, right? You'll have decreased blood flow. Therefore, you will start to lose or thin the hair aspect of it. Think about it when you have full-blown diabetes. What happens? Your vision will go because the microvasculature to your eyes are damaged. And then your toes might develop ulcers because you don't have proper circulation, you get infection. So thinning of the hair is an early chief complaint. Also infertility. There's a condition called PCOS, or polycystic ovarian syndrome, where you have issues with sugar dysregulation and insulin. So PCOS may be a cause of infertility and hormone imbalance. Again, we're talking about things like leptin, testosterone, estrogen. So what people don't realize is that these hormones are converted in fat tissue. So when you take a typical person who has insulin resistance or prediabetes, they may have excess of belly fat. When you have belly fat, for men, you're going to start converting your testosterone to estrogen. And you're going to have development of more emotions, or you may have man boobs. You may have some signs and symptoms of becoming more female-like because you have overconversion of your testosterone to estrogen. And for women, it's the opposite. When you have excessive belly fat, you're going to have excess conversion of estrogen to testosterone. So you may actually develop maybe like a little bit of hair on your chin or acne Okay, so you may have some issues with hormonal imbalance as a chief complaint. So they'll come in with these chief complaints, but then they don't realize they have a blood sugar problem. So in order to fix this or correct this, you have to address the insulin resistance and diabetes. Now, what are some of the early signs and symptoms of pre-diabetes, diabetes? Right? Oftentimes what you get is fatigue after meals. So you eat a large meal at lunch and you sit down and you're trying to get back to work, and about 15 to 20 minutes later, you're nodding off in front of the computer, right? You're going to get fatigue after meals. Crave sweets after meals. So you had that meal, you feel a little sleepy, so what do you reach for? A second cup of coffee with extra cream and extra sugar, or you want like cookies or chips, particularly at night. So you have your dinner and you're opening up the fridge looking for something else to eat, like ice cream, cookies, chips, whatever it is. Okay. You have difficulty losing weight, especially that what we call central adiposity, that belly fat. You have difficulty losing weight as a result. You fall asleep after lunch and dinner. This is typical. You work and you come home, you eat your meal, sit in front of the TV, and about 15 to 20, 30 minutes later, you're falling asleep on the couch. You'll fall asleep for 20 minutes, and you go, oh, I gotta go to bed, and you're wide awake, okay? You're gonna have sleep issues or disturbances as a result of pre-diabetes. You also have frequent urination. So you realize, like, I'm going to the bathroom more. I am peeing, right? But I'm just going more frequently. And those are the early signs and symptoms of insulin resistance or pre-diabetes. So in order to categorize what insulin resistance is, basically fasting blood sugar is between 100 and 126, and your hemoglobin A1C, which is your 2 to 3 month average, is 5.7 or greater, up to about 6.4. Okay? These are your basic markers to look at pre-diabetes. In our next video, I'm going to go in depth about lab testing in order to figure out if you have insulin resistance. So we're going to go into things like hemoglobin A1C, fructosamine, C-peptide, fasting insulin, the HOMA calculator. So we're going to go into a bunch of different testing mechanisms to determine if you have pre-diabetes. How do we diagnose insulin resistance, diabetes, and metabolic syndrome? Today, we're going to go into a deep dive of laboratory markers that will help determine if you have these conditions. So let's get right into it. Number one is fasting glucose. Fasting glucose is basically morning glucose when you have not eaten for 10 to 12 hours and you do a glucose test, okay? The marker should be between 65 and 99 in the morning. You can also do a postprandial glucose, which is after a meal. Let's say you had dinner, wait 2 hours, and your blood glucose should be under 140. Now, these two tests you can do at home. You can purchase a glucometer or glucometer, and you check your first morning glucose and 2 hour postprandial glucose. And that'll help you determine to see if you have the first signs of insulin resistance. Next is hemoglobin A1C. This is a 3-month average, and you can do this non-fasting. Basically, you can eat, it doesn't matter. So it's a 3-month average, and it should be between 4.8 and 5.6. Anything above 5.6 is considered insulin resistance. When you start to approach 6.2, 6.5, then you're getting into that diabetic range. There's another marker called fructosamine, and it's 190 to 285. You can do this non-fasting. Hemoglobin A1C is a 3-month average, but fructosamine is more a 1 to 3 week average of blood sugar. Glycomark, you can do that non-fasting, and this one looks more at sugar spikes. So you want to make sure we're not having this wild fluctuation of sugar and insulin throughout the day, and Glycomark can be a good test for that. You can also do glucose and insulin. you can do 3 samples. So you go to the lab, they give you a glucose solution, or basically sugar. They'll do glucose and insulin in the fasted state, and then they'll do one at 1 hour and 2 hours. Okay? When you drink the glucose load 1 hour after, your insulin should be less than 164, and glucose should be below 199. At the 2-hour mark, it should be below 145, and glucose should be below 140. So oftentimes they do this type of test for checking for gestational diabetes. But it's also a good test to see if you have insulin resistance. So that you can do at the lab. When we do all these tests combined, we can kind of figure out if someone has pre-diabetes or diabetes. For metabolic markers, we can check lipid panels like cholesterol and triglyceride, etc. Because when you have high triglycerides in the fasted state, it's likely that you have insulin resistance or sugar dysregulation. CBC with differential, looking at red blood cells, is also important because we're also looking at hemoglobin A1C. And if we have things like anemia, it could impact how hemoglobin A1C will look like, right? Because basically, hemoglobin A1C is sugar attached to hemoglobin. And if you have anemia, it's going to impact that. The other one would be C-peptide. C-peptide is basically a short-chain amino acid, and it's produced when you produce insulin. However, the half-life of C-peptide is longer than insulin, so it's a good indication of whether C-peptide is elevated or decreased. Now, when you have an elevation of C-peptide, basically your body is producing too much insulin, and it can help diagnose type 2 diabetes or insulin resistance. If your C-peptide is low, your body's not producing enough insulin, and it can help you diagnose type 1 diabetes, basically the autoimmune version where you're not producing insulin from your pancreas. So you can utilize C-peptide to differentiate whether someone has type 1 or insulin resistance or type 2 diabetes, okay? Inflammation can also impact sugar, so you should also check for CRP or C-reactive protein and ESR or erythrocyte sedimentation rate. So that gives us a good idea. When I flip the board, I'm going to go in detail on how you're going to use these markers to determine if you have insulin resistance. Now, like I said, you can do these 2 tests at home. Fasting glucose should be done at 10 to 12 hours fasting. 2-hour postprandial, you can do these 2 tests at home. Now, if you're above 99 at the 10 to 12 hour mark, let's say you're at 110, right? But your triglyceride in the fasted state is like 220, 250. That means you are leaning towards insulin resistance. In the fasted state, the triglyceride should be below 100, okay? Hemoglobin A1C, this is basically glycation of hemoglobin. So the percentage of hemoglobin that is attached to sugar is what they're checking here. And it's a 3-month average. Elevation of hemoglobin A1C is predictive of diabetic complications. Things like kidney disease, right? Or it can also increase advanced glycated end products. Advanced glycated end products need to be filtered through the kidneys, so the kidneys continue to take a hit. When you have diabetes, you're going to end up with kidney disease. So you have to check also things like GFR or creatinine in order to determine if you have kidney dysfunction, or cystatin C, okay? Like iron deficiency markers can also impact hemoglobin A1C, so iron deficiency because it impacts hemoglobin. Kidney or liver disease, inflammation, and oxidative stress all impact how hemoglobin A1C will look. That is why it is important to run other markers, not to just run fasting glucose and hemoglobin A1C. You want to run other markers to determine if you have insulin resistance, prediabetes, diabetes. Fructosamine is a glycation of protein, basically albumin and IgG. So it's basically sugar attached to these two proteins, and it's a 1 to 3 week average. So we use fructosamine, let's say, if you get a baseline, patient comes in, and your hemoglobin A1C is elevated, fasting glucose is elevated. But if you want to know if a patient is compliant to what you're asking them to do, you can do a fructosamine test in the beginning and do it 1 to 3 weeks after to see if that number is improving. You don't have to wait for 3 months. You can just do a fructosamine test at the 1, 2, or 3 week mark to determine if you have issues or improvement of blood sugar. GlycoMark helps to look at what we call hyperglycemic spikes. So this up and down of blood sugar. So if, let's say, on average, you have a high blood sugar, low blood sugar that goes up and down throughout the day, but the average looks about normal. So you may have a normal hemoglobin A1C, yet you can have spikes throughout the day, which would cause insulin spikes, glucose spikes, and then drops. Okay, so GlycoMark is good for that. C-peptide. Again, C-peptide is tied to insulin production, longer half-life. C-peptide is filtered through the kidneys also, so that's why it has a longer half-life. So it's important to check, and it also helps you determine if someone has type 1 diabetes or type 2 diabetes. Last one is called HOMA calculator IR, okay, insulin resistance. This is fasting glucose multiplied by fasting insulin. So you do that first morning glucose and a fasting insulin together, and you divide it by these factors, one or the other, and it'll give you a number, right? So if it's less than 1, your HOMA calculator IR, right? IR is less than 1, it's optimal. If it's above 1.9, you are developing insulin resistance. If it's above 2.7, you have significant insulin resistance. So the HOMA IR is very important to determine insulin resistance early on. You use combinations of these tests to determine if someone has a problem, because really, you could cheat the fasting glucose. So you have patients sometimes, you tell them to do a fasting glucose, and they know they have a problem. So they'll go 14 or 16 hours of fasting and do this test, and it's below 100, and it looks normal. But if you did a hemoglobin A1C or fructosamine test or a HOMA IR, you're going to pick up those individuals who have insulin resistance. So that, in a nutshell, is all the tests that you would utilize to determine if you have insulin resistance or prediabetes or even metabolic syndrome. Are you tired, angry, irritable if you skip a meal? Do you wake up 2 or 3 in the morning and can't go back to sleep? Well, your blood sugar may be crashing. So today we're going to talk about hypoglycemia, and we're going to define the 3 mechanisms. Hypoglycemia, pathological. This is when your fasting glucose will be below 65 in the morning. Sometimes it'll be in the 40s. This is usually caused by some sort of disease process or exogenous insulin. So diabetics will often go into a pathological hypoglycemia when they do their injections, but they're not eating enough to sustain their blood sugar levels. Medications like metformin, etc., can also cause this pathological fasting glucose to drop below 65. Hypoglycemia, functional. This is fasting glucose below 85, and you'll have another marker called LDH, or lactate dehydrogenase, and that will be below 140. That could be indicative of hypoglycemia. Symptoms are unrelated to any type of disease or medication, and symptoms are resolved when you eat. So as soon as you eat, 10 to 15 minutes later, you're like, ooh, I feel so much better. There's another one called hypoglycemia reactive, right? You eat, and within 2 to 3 hours of eating, your blood sugar will drop. So this is where you eat, let's say, something sugary like pasta or some sort of like a bread or sandwich or etc. Right? You're going to have a spike in glucose followed by a spike in insulin. And once that happens, glucose will drop and crash very quickly for these individuals. So 2 to 4 hours after you eat, you get shaky, irritable, angry, and you need to eat again. So the typical patient who has hypoglycemia like this are usually women. They're thin, they have low blood pressure and low cortisol. So they have a hard time getting up in the morning. They drink a large cup of coffee with extra cream, extra sugar. They get their energy. Just before lunch, they're famished. They get a little irritable. I gotta eat. So they eat something sugary, right? And a sugary drink around lunchtime. They have that, they feel a little better, and around 3 or 4, they're crashing again. So they get this up and down of sugar throughout the day, followed by insulin. And whenever you have these spikes and lows, you are causing inflammation. So a lot of these patients will have, they look fine when you just look at them, but they have low energy, low blood pressure, and low glucose level, and they're always tired. Their mood goes up and down, their energy goes up and down, and they just don't feel well, okay? So those are the 3 types. In my next video, we're going to go ahead and discuss all the symptoms and some of the causes for hypoglycemia. But if you would like a cheat sheet on all the symptoms related to low blood sugar and high blood sugar, click on the link below. It's my free community where you can go ahead and download all the symptoms related to blood sugar dysregulation. Diet and lifestyle that impacts low blood sugar. What are some of the symptoms and some of the chief complaints that patients present with when they have low blood sugar? It's often common when you go to the doctor's office, they're more concerned about insulin resistance, diabetes, or prediabetes. In this case, low blood sugar has just a bigger impact as insulin resistance or diabetes in the long run. Oftentimes people come in, they have low blood sugar issues, and they have many symptoms related to it. So let's get into some of the lifestyle. Diet and lifestyle. Number 1, they often tend to skip meals. They'll skip breakfast or lunch, yet they feel anxious and jittery related to skipping that meal. Avoid snacking because they don't want to get quote unquote fat, so they won't eat. When they do snack, they'll have a high sugar snack, a cookie, a Snickers bar, right? Or a sugary drink. They often use coffee to suppress appetite also. So these are the patients who get up in the morning, they can't get up and go. So what they do is they get a large cup of coffee with extra cream, extra sugar, and they'll drink that throughout the morning just to suppress the appetite and get through the morning. Oftentimes when they do eat, they're eating more sweets and not meals. They eat these cookies, let's say oranges, and then they'll have a sugary drink, and they kind of go through the day just eating sweets. They have long gaps between dinner and their first meal. They'll eat dinner around 6 or 7 p.m., and they won't have another meal until noon the next day because they had this big cup of coffee. However, these patients will have dinner around 6 or 7, and about 5 to 6 hours later, their blood sugar will drop. What this means is that when they get up around 1 to 2 in the morning, go to the bathroom, and they can't go back to sleep. So these are the patients where they just wake up and they can't go back to sleep. What's happening is around that 1 to 2 a.m., blood sugar is dropping, wakes them out of a deep sleep because cortisol will go up as a result. When cortisol goes up, it's signaling to the liver, hey, I need more glucose. It starts the process of what we call gluconeogenesis. So cortisol will tell the liver, hey, I need some more sugar, but cortisol also wakes you out of a deep sleep. So they'll get up 2 in the morning, can't fall asleep until 4 in the morning, and now they're tired the next day. They also lack protein, good quality fats, and fiber in their diet because they're mostly eating sweets. Also, they tend to overtrain. They work out, they want to get more muscle, they want to get leaner, skinnier, etc., but they're not nourishing their body. So these are all lifestyle factors that can lead to different signs and symptoms. So these factors will go here, and now you have symptoms. You crave sweets all the time. You're irritable if you miss a meal. You get angry, hangry, right? It's that classic Snickers commercial. Irritable, anxious. You depend on coffee all the time because you're tired. You didn't sleep well the night before because you woke up 2 in the morning and couldn't go back to sleep until 4. Feel lightheaded when you miss meals. Eating relieves fatigue. So this is really a telltale sign. You're really tired, you're anxious, irritable, and you eat. About 10 to 15 minutes later, you're like, whew, I feel so much better, right? Eating relieves your symptoms. You feel shaky, irritable. You feel that inward trembling, right? Or your hands tend to shake when you try to reach for something. You get poor memory and blurred vision. Why? Because it starts to impact the brain. You don't have enough fuel. You have lack of sugar, and you have a drop in sugar when you eat sugary meals. So you get all these symptoms, and they present to my office, and they go, Dr. Sung, I'm tired all the time. I have insomnia, right? I said, if you have long gaps between dinner and your first meal, you're going to have awakening around 2 in the morning. You feel anxious and depressed. You also complain of infertility, having a hard time getting pregnant, headaches, and then hormone imbalance. So let's say you went to your traditional doctor or your conventional doctor. You went to your primary care physician and go, I'm tired all the time and my muscles ache. Well, you might have fibromyalgia. We'll send you to a rheumatologist, get evaluated. I can't sleep. Well, here's a medication for that. I feel anxious and depressed. Here's another medication for that. I have a problem getting pregnant. Well, we'll send you off to the infertility clinic and they can run some tests for you. I have headaches. Well, you go to pain management, you'll do some medications, etc. Hormone imbalances, might be put on a birth control pill, etc. You see what I'm getting at. It takes you down that road of chasing symptoms and complaints rather than looking at the lifestyle factors associated with low blood sugar. So the more women tend to have this condition, so like 3 to 1. They're usually kind of thin-framed, they have low blood pressure, low cortisol, and low blood sugar. So they get up in the morning, they're exhausted, I gotta get going in the morning, right? I don't feel like eating, so I'm gonna get a Dunkin' large iced coffee with extra cream, extra sugar. You start drinking, you start to feel a little bit better. And your blood sugar starts to drop around 10 or 11, you feel shaky, irritable. So rather than eating, you get a cookie or you grab something sugary or chips, whatever it is. And then lunchtime comes around, you don't feel like really eating so much because you have so much coffee, and then you might have another snack, a donut or something. Come dinner, you might have a normal dinner, but you have it around 6, and then 1 or 2 in the morning, you wake up, can't go back to sleep, 2 to 4. Now you're tired again the next day. So this vicious cycle is happening day after day after day. And what happens with these patients is when they have hypoglycemia, let's say in their teens and 20s, eventually it leads to diabetes, right? Because you have spikes of blood sugar when you eat these sugary meals and a spike of insulin to take the sugar out of your system. And this wild fluctuation day after day after day will eventually burn out your pancreas. And you will develop prediabetes and diabetes later in life. So it might be in your 40s, 50s, or 60s, all of a sudden you shift from low blood sugar to now you have insulin resistance and diabetes. So So this is a very important factor. What do you have to do? You have to eat high quality fats, more protein, and eat more frequently until your blood sugar can stabilize. These are the patients who should not do fasting. You don't do intermittent fasting and prolonged fasting when you have hypoglycemia. You need to stabilize blood sugar first, get your body and your systems functioning well before you move on to the next step. Normal sugar, low blood sugar, or high blood sugar. Which one do you have? And if you don't have access to testing, this is the video you want to watch to determine which of the three you have. So let's get right into it. Normal, low, and high blood sugar all have symptoms related to it or lack of symptoms. So let's look at normal blood sugar. With normal blood sugar, you wake up and feel normal energy and you feel rested. This means you get out of bed and you go, I feel pretty good today. Let's get ready and get started for the day. You'll wake up with an appetite. Within like 10 to 20 minutes, you feel hungry. You want to eat something. Hunger between meals, not sugar cravings. So if you go 3 hours, 4 hours after eating, let's say breakfast, you may feel hungry, but you're not craving sugar. Like I want to reach for a candy bar, a cookie, or a cupcake, okay? No change in function between meals. Low blood sugar has a host of different symptoms, as well as high blood sugar, which we'll go over in a minute. So there should be no change in symptomatology. There's no change with eating also. No fatigue or change in energy with eating. So I ate lunch, my energy is still pretty good, no change. I don't feel tired, I don't feel energized, I just feel normal. That is normal blood sugar here. So let's compare that to hypoglycemia or low blood sugar. These patients often have difficulty waking up in the morning. They feel groggy and they just have a hard time getting out of bed. This is the individual who hits that snooze button 3 or 4 times. They have no appetite in the morning, so they're often reaching for some caffeine or something with sugar in it to get themselves started. So they need that caffeine, a little bit of sugar, get that blood sugar up to get the energy. So energy comes after meals. So they eat that muffin. Oh, I feel a little bit better. I feel, I can focus a little better. I eat lunch and I feel better. They crash between 3 to 5 p.m. So when their blood sugar starts to drop throughout the day, around just after lunch, maybe 2 o'clock, 3 o'clock, they start to crash, right? And then they have difficulty staying asleep. They wake up typically around 2 or 3 in the morning and they can't go back to sleep. It may take an hour or even 3 hours before they can fall back asleep. This is usually because they eat dinner, let's say around 6, and then by 6 to 8 hours after that meal, the blood sugar is dropping. Once blood sugar is dropping, cortisol goes up. Cortisol will signal the liver to produce sugar or gluconeogenesis, but a spike in cortisol will also wake you out of a deep sleep and you can't fall back asleep. Oftentimes that vicious cycle of I stayed up, I couldn't go back to sleep, you wake up and you have difficulty getting up and you're feeling tired, okay? On the flip side, we have high blood sugar or insulin resistance, prediabetes, or diabetes. These individuals will wake up and they don't feel rested, okay? They don't feel recovered. The body kind of aches and just very heavy, okay? They wake up with sugar cravings. So these are the people who get up, they'll have, let's say, a muffin and a bowl of cereal or Cheerios or Fruit Loops, whatever it is. They often eat high sugar and high starch breakfast. So they're looking and craving for that sugar first thing in the morning. Sugar cravings also occur after meals. So let's say you worked all day, you come home, you had a big meal, and you should be satisfied. But this is the individual who opens the refrigerator door and goes, what else is there to eat? Or they grab for a bag of chips or ice cream. So they crave sugar after meals. They crash after meals also. So after a heavy meal, they can sit on the couch and about 5, 10, 15 minutes later, they're nodding off in front of the TV. And it might be like 8 o'clock. And then they sleep for half an hour. And when they try to go to bed, they can't go back to bed. So they have difficulty falling asleep. So they may be up at midnight, 1 o'clock, 2 o'clock. They're watching Netflix, right? 1, 2, 3 episodes. And they can't fall asleep. And the next morning, they feel not rested and not recovered. So they have the vicious cycle of not sleeping well and feeling fatigue, craving more sugar, etc. They also have a need for stimulants. So after lunch, often these people have eaten and they're feeling a little tired, right? They start to feel that sleepiness. So they want another cup of coffee. Oftentimes that is a telltale sign. So let's keep it really simple. How do we determine whether you have one of these symptoms, okay? So let's just look at meals. If there's no change in function between meals, you eat, you don't feel energized because you eat, your energy is normal, or you don't feel sleepy after you eat, that means you have normal blood sugar. On the flip side, if you have energy after meals, before you ate, you felt irritable, angry, jittery, tired, and you eat and you go, oh, I feel so much better. Your energy kind of comes back up. That's hypoglycemia. This one, you crash after meals. You fall asleep, you doze off. You want a cup of coffee to stay awake after lunch. So if you just look at the meals and you have these symptoms, you can determine which type you are. Obviously, we all want to be in the normal phase, have good energy, sleep well, etc. But if you have one of these two, you will eventually end up with diabetes. Does chronic stress cause diabetes? Today, we're going to get into how stress hormones can impact insulin resistance, leading to diabetes, and all the different lifestyle factors that may contribute to insulin resistance and diabetes. So let's get right into it. Stress and sugar. Adrenal islet cell axis. Okay, this is talking about how your adrenal glands can impact the pancreas and its insulin production. So, chronic stress response. Ongoing glucose demands to deal with high stress. So if you have stress or in stressful moments, what happens is there's more glucose need. So your body will use your glucose stores or glycogen stores, and then it has to go into what we call gluconeogenesis to produce more sugar in order to sustain that high stress moment. So what happens is if you have this prolonged stress, like regular stress, if you have a stressful moment, you have a test, you're stressed, but once the test is over, the stress is gone. But if you have chronic stress, marital stress, things that your child is sick, like prolonged stress, what happens is there's a chronic HPA axis, which is hypothalamic pituitary adrenal axis, activation. So you're activating the cycle of chronic stress related to the brain and the adrenal glands. Okay? So when you stimulate the HPA axis, what happens is you're going to get a bump in cortisol. Cortisol is normal in our body. It's usually higher in the morning when you get up, and then it goes down, and by evening it's low so you can go to bed. Cortisol is inversely related to melatonin. So melatonin is low in the morning and goes high towards the evening so you can go to bed. But if you have high stress levels, what happens is cortisol or high levels of cortisol will create insulin resistance. So insulin is not as effective. And in response, your body will increase secretion of insulin from the pancreatic beta cells. So because cortisol makes insulin less effective or less efficient, your body will produce more insulin to try to uptake the sugar into the cell. So that will create a situation where we have hyperinsulinemia, high production of insulin because of stress. Now, chronic Stimulation of the hypothalamic pituitary axis will cause insulin activation again. So you have this vicious cycle, and then you have hyperinsulinemia also stimulating the activation of the HPA axis. So you have this vicious loop that cannot be broken unless you change something. The change is really lifestyle. So let's get right into that one. Again, we're talking about stress and sugar, right? What lifestyle factors can contribute to it? People don't realize overtraining can also stress your system. So let's say you're an athlete, you're training 3 times a day, but you're not getting the proper rest. You're overtraining without the rest and your body starts to break down. Or you're a triathlete, training every single day, right? Running long miles, swims, biking. And over time, what happens is because you have a heightened stress response, you will develop issues with insulin resistance. Overworking is also the same thing, whether it's a physical job or you're working 2 jobs to support your family. Long term, it's going to impact stress levels, obviously, along with cortisol and then insulin. Lack of sleep. If you have poor sleep over time, it's going to definitely increase your risk for diabetes. So proper sleep is necessary. Psychological stress. Now, we don't talk a lot about what we call PTSD or those types of things, but chronic psychological stress, even from childhood on, right? If you had like a significant childhood event, this can create a lot of psychological stress over time, again, leading to cortisol issues, insulin issues, as well as diabetes. Now, these are long-term effects here. But there are people who miss meals, or what we call hypoglycemics. They have low blood sugar issues, they miss meals, and they have a rapid need for cortisol, insulin, etc. Right? They eat sugary stuff, and they just need that quick fix in order to fix their symptomatology. Also, people who have a lot of excess simple sugars, they also tend to have issues with insulin spikes, cortisol spikes, etc. Right? Now, does athletes need some simple sugar when they're trying to perform? Sure, but there are a lot of people who drink a lot of sugary drinks, caramel lattes, these new things called the boba teas, where they put a lot of extra sugar in them. So there's a lot of sugar in the diet. Okay, so what's going to happen? These are all lifestyle triggers, right? If you're really healthy, you get your proper rest, you're resilient, and you're healthy, you will have no symptom changes. You can kind of brush it off and be okay. So it's like you're 18 years old, right? You worked, and then you went out with your friends, you only slept 3 hours, but then the next day you can go out and work again and go out again the next night, etc. You're relatively young, you're resilient, and you don't seem to really have any symptoms, okay? But over time, especially as we age, we lose stress resiliency. So there's a tipping point. You get stressed over time, and then there's a tipping point. It's like that person who has stressors here, constantly coming. They're handling it well, and then someone honks at them on the highway, and they lose it, right? They just completely lose it because their stress was so high that little bit of stimulus of someone honking at you throws you over the edge. You get angry and irritable, and you kind of lose it, okay? That's stress resilience, right? Your tipping point is very, very low. It's just gonna tip right over if you just put a little more stress onto it. The problem with this is that it creates a lot of health issues. Dysglycemia, we talked about insulin resistance, diabetes, hypoglycemia. So if you lose your stress resilience and you have issues with cortisol, you're gonna have dysglycemia, whether it's insulin resistance, pre-diabetes, diabetes, or people who have hypoglycemic ups and downs. It also creates insomnia. Patients don't realize that high blood sugar causes sleep disturbances as well as low blood sugar. For instance, if you have high blood sugar or insulin resistance, You're that individual will have dinner, sit in front of the TV, and literally 5 to 10 minutes later, you're nodding off. Okay? You fall asleep for maybe 10, 15 minutes. You get up and you go, oh, I should go to bed, wide awake. Can't fall back asleep. It might take you an hour or two, or you might watch 3 episodes on a Netflix series. So you have issues with sleep as a result of prediabetes or diabetes. Now on the flip side, if you have low blood sugar or hypoglycemia, what happens is you'll sleep okay, you'll fall asleep okay, but around 2 or 3 in the morning, you'll wake up out of a deep sleep because your blood sugar dropped. If your blood sugar drops, cortisol will go up to signal your liver to produce sugar, a process called gluconeogenesis. Okay? So when your blood sugar drops, cortisol goes up, tells the liver, hey, I need more sugar. Okay, great, producing more sugar. But that cortisol spike just woke you out of a deep sleep. And now you can't go back to sleep for an hour, 2 hours, or 3 hours. And then you finally get back to sleep and your alarm goes off. And you didn't have a restful night of sleep. And sleep also impacts cortisol. Also, cortisol and blood sugar dysregulation will certainly impact high blood pressure or hypertension. You'll have issues with weight gain or stubborn weight gain where you can't lose it. And then also impacts our immune system. Cortisol at high levels or prolonged cortisol levels that are elevated could start to impact your gut microbiome, impacting how your immune system works, etc. Now, when we look at this, you have to ask yourself, are you overtraining? Are you overworking? Are you lacking sleep? Is there psychological stress? Like some of these things that you need to work out on your own. You need to figure out what are your triggers and fix those triggers. But essentially, you have to remove or reduce some of these impacts in order for you to feel better. Now, everyone is different. Not everyone's going to react the same or as quickly if you have a change in diet, right? Because some people, we could put them on a sugar-free diet for, let's say, a week or two, and they'll lose close to 10 pounds. All of that is really related to water retention. They're losing a lot of water weight. But then some people, you can put them on a clean diet, they can't lose weight. It might be like half a pound in a week. They're like, I'm eating so clean, I don't understand. Well, you got to break that vicious cycle of this adrenal, pituitary adrenal axis where it's impacting insulin. So in order to break that, it takes a little time, a little effort, but it's very important, right? Starts with stress reduction, sleep, exercise, and eating the right foods in order to get you back on the right track. How to fix low blood sugar or hypoglycemia. My name is Dr. Jin Sung, where clinical excellence meets excellent results, and let's get right into the video. So how do you fix it? Become more keto adaptive. So people who have low blood sugar issues, they tend to eat a lot of carbohydrates. And what happens with high intake of carbohydrates, they have an insulin spike and then a drop in blood sugar again. I have a separate video on the symptomatology of hypoglycemia, so I'll link that in the description below. So being more keto adaptive meaning you need to eat more fats. So there's something called a ketogenic diet, which will help improve the utilization of ketones for fuel rather than glucose. So patients who have hypoglycemia or low blood sugar should eat more fats or quality fats, more protein, vegetable fibers, and very minimal amounts of fruit. They need to be more adaptive before going into other types of dietary regimens like intermittent fasting. Initially, they need to eat frequently enough to avoid symptoms of hypoglycemia. So symptoms of hypoglycemia are those individuals who will eat, let's say, lunchtime, and 2 or 3 hours later, they might get shaky, irritable, annoyed, or hangry. So you definitely want to eat frequently enough to avoid those symptoms of hypoglycemia. Also, patients who have hypoglycemia tend to wake up around 2 or 3 in the morning. So they'll eat around 6 p.m., they'll have dinner, they don't want to snack, they don't want to get fat. So They won't eat anything throughout the evening. And then 2 or 3 in the morning, they'll wake up and they can't fall back asleep and they don't understand why. So 1 hour before bed, what you want to do is eat some quality fat and protein. My recommendation is to eat a slice of organic turkey along with a sliver of avocado 1 hour before bed. This will prevent the drop in blood sugar around that 2 to 3 a.m. and prevent you from waking up in the middle of the night. So that drop in blood sugar is what really wakes you up in the middle of the night, okay? Now, with supplements, you can use adaptogens like Panen's ginseng, holy basil, and rhodiola, and there are others. Oftentimes, supplement companies will make a combination of different types of herbs or what they call adaptogens. You'll also need B complex and some minerals, especially magnesium. You'll need fiber, pectins, guar gum, flaxseed, etc. Plant sterols like vegetables, nuts, and seeds will provide plant sterols, but you can also get it in supplement form. Branch chain amino acids are also important, leucine, isoleucine, valine, and this basically comes from animal protein. You can get it from beef, chicken, seafood, etc. If you're a vegan, you got to make sure you're getting enough quality vegetable-based proteins to round out your supplements or your protein load. So in order to fix low blood sugar, you need to kind of do this consistently for at least 2 months. And then you'll know that your symptomatology will start to subside. You don't have those ups and downs or crashes related to blood sugar. Obviously, this portion right here in blue is very, very important as your baseline. Also, sleep, stress reduction, and those types of things are also very important. But these supplements can be used in the short term to help individuals get out of those hypoglycemic events. How do you fix insulin resistance or pre-diabetes, or even diabetes if you're not insulin dependent? So let's get right into this video. Number one is really a ketogenic diet or even a carnivore diet. You can do this temporarily to manage your insulin spikes and manage the insulin resistance. Another way is intermittent fasting, where you're eating for a short window of time. So you might eat for an 8-hour window, 6-hour window, even a 4-hour window. One, intermittent fasting will reduce your caloric intake, but two, it also prevents these insulin spikes when you're eating too frequently. So intermittent fasting is also a great way. A 3 to 5 day water fast can have many different benefits. However, it can also help reset that insulin, right? So insulin sensitivity will improve if you do a 3 to 5 day water fast. I made some videos on this, so I'll link that in the description below. Number two is exercise. 30 to 45 minutes per day, a combination of cardio and weight training. Or you can alternate it. So one day you'll do cardio, another day you'll do weight training. Building muscle mass is very important, as well as cardio, just to burn more fat, okay? So exercise is going to be a crucial component of this. Stress reduction and sleep is also very, very important. I have a community where we did a challenge, and what we did is a glucose challenge and looked at and monitored blood glucose on a daily basis. And what we found is that stress will spike blood sugar as well as a lack of sleep. So you need to reduce stress and improve sleep. You need these three as a foundation in order to take supplements and do other things, okay? So doing these first 3 steps and then adding supplements can be a game changer in terms of managing blood sugar. So what are the supplements we like? We like resveratrol, a liposomal form. It helps to blunt the oxidative stress. Berberine, you can use berberine plus rosehip, burdock root, and alpha lipoic acid. They work more synergistically, improving insulin sensitivity, improving short-chain fatty acids like butyrate, propionate, and acetate. We also like glutathione for the oxidative stress, so liposomal form is best. We also like Genema sylvestre, which is a plant, helps with insulin resistance. We also like fish oil. You can use alga oil or krill oil, but we like the fish oil, EPA, DHA. We like at least 200 milligrams of it per day. And a diverse vegetable fiber. Diverse vegetable fiber will also help improve short-chain fatty acids. The gut is very important in terms of regulating some hormones, also improving insulin sensitivity. There's been some studies about Akkermansia municipale and its management of blood glucose. So improving short-chain fatty acids with diverse vegetable fibers will be very important also. So I'll link some videos on the intermittent fasting and 3 to 5 day water fasting videos in the description below, which will help you manage your blood sugar. All right, my name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.